Take-home Naloxone for physicians, a Saskatchewan Health Authority training deck. Take-home Naloxone is a harm reduction initiative that is grounded in the vision, mission, values, and philosophy of care of the Saskatchewan Health Authority. This presentation will provide physicians with the core knowledge that patients should have prior to receiving a take-home Naloxone kit. By the end of this module, you will be able to understand the principles and benefits of harm reduction, describe the effects of opioids, describe risk factors for overdose and preventative strategies, recognize and respond to an overdose, provide take-home Naloxone kits to patients, including teaching and patient knowledge assessment, and finally, perform the necessary recording and reporting measures for the Ministry of Health. The Saskatchewan Health Authority recognizes harm reduction as an important component in the continuum of care. Harm reduction refers to policies, programs, and practices that aim to reduce the adverse health, social, and economic consequences of substance use without mandating abstinence. It may be considered an outreach and engagement conversation with people who are actively using or their family members to educate them with regards to the services that are available. Take-home Naloxone is a safe and effective harm reduction strategy that reduces morbidity and mortality related to opioid overdose. Harm reduction benefits everyone, people who use substances, their families, and their communities. At an individual level, harm reduction interventions can reduce the spread of HIV and hepatitis C. It can also decrease emergency visits and help to connect people to care and services. Finally, it can provide empowerment and capacity building for people who are in denial or pre-contemplation with regards to their substance use. At a community level, harm reduction decreases crime and provides a safer social environment. It also lowers healthcare costs and improves population health outcomes. Finally, it decreases stigma and discrimination as healthcare providers engage more constructively with people who are using substances. People who use substances are often not well received within the healthcare system. Communication is key to engagement and providing respectful, compassionate care. Two key principles include, number one, using neutral, medically accurate terminology, congruent with DSM-5, such as a substance use disorder or an opioid use disorder. Secondly, we should use people-first language. Rather than the pejorative addict, junkie, or user, we should use terminology such as people who use drugs or people with a substance use disorder. In the following slides, we will review risk factors for overdose and provide key messages you can give your patients when you are counseling them on take-home Naloxone. Mixing drugs increases the risk of an overdose or poisoning. In particular, CNS depressants such as alcohol, benzodiazepines, opioids, gabapentin, and pregabalin mixed together can synergistically increase the risk of overdose. A popular misconception is that stimulants and depressants, when used together, cancel each other out. However, together they may actually increase the risk of overdose because the body has more drug to metabolize, and they metabolize at different rates. For example, stimulants may metabolize more quickly, but whilst active, may induce a person to take more depressant. Once the stimulant is metabolized, the depressants will dominate and synergistically may lead to an overdose and death. The key message to patients, therefore, is to try to use only one drug at a time to decrease risk. Secondly, stimulants or uppers and depressants or downers don't cancel each other out and can increase one's risk of overdose. The quantity and potency of illicit drugs can also contribute to the risk of overdose. Illicit opioids vary greatly in potency and have unpredictable effects. They can be made to look like prescription opioids, but contain much higher doses than expected, or different opioids altogether. An example of this are the illicit Oxy 80s, or OxyContin 80 milligram counterfeit tablets that were pressed and intended to be crushed and snorted. Rather than oxycodone, these tabs contain fentanyl, unevenly distributed throughout the mix and throughout the tablets. A key message to patients is to be careful when substituting one opioid for another, and to always start with a small dose or test hit, especially if it is a new product. Tolerance is another important risk factor because it drops rapidly within a few days of not using or when using less. High-risk situations occur for decreased tolerance when people are released from incarceration or detox or hospitalization. During this period of non-use, they have reduced tolerance, may go back to their lived environment where they used aggressively and relapse. The key message to patients is if you're using after a break, start with a smaller amount. Individual health status or general physical health also plays a role in overdose risk. Impaired liver or body function can affect how the drug is metabolized. Similarly, compromised pulmonary function can lead to greater sensitivity to respiratory depression and arrest. The key message to patients is that if they're sick or feeling unwell, they should consider taking a break from their substance use and seeking medical attention. If they have to use because of the adverse effects of withdrawal, they should use less than what they're used to and give their body a chance to adjust and heal. The route of administration of a drug determines how quickly it takes effect. The key message to patients is to use the safest route possible. The safest, of course, is not to use at all. However, swallowing is safer than snorting or smoking, which is safer than IV drug use. Not injecting can also reduce the risk of getting HIV or hepatitis C. A previous overdose is a risk factor or predictor for a future overdose. The key message for patients is that if a person has ever had a non-fatal overdose, that this increases the risk of a potentially fatal overdose in the future. This is because people who have overdosed before may have high-risk drug use patterns or access to more potent drug supply. In addition, experiencing a non-fatal overdose may cause damage to the body. For example, one may experience an aspiration pneumonia with compromised respiratory status, or alternatively, an hypoxic encephalopathy with poor impulse control and decreased cognitive functioning. We can support patients who use opioids by providing overdose prevention education. Key messages to convey include: do not use alone. use safer routes of administration. Do a test hit first. Start low and go slow. Know the signs and symptoms of an overdose. If they are to mix drugs, they should use the opioid first and wait before adding other drugs. They should not underestimate the effects of alcohol as a depressant. They should carry naloxone and ensure that their associates also carry naloxone. If there is an overdose, they should call 911. They should also know where to find resources and support to replenish their take-home naloxone kits and also to access mental health and addiction services. Patients need to know that if someone is overdosing from an opioid, it is not helpful to let them sleep it off, to give them amphetamines to wake them up, to put them in a cold bath or shower, to slap, hit, or punch them to try and wake them up, or to try to get them to vomit. If one witnesses an opioid overdose, it is important to understand that respiratory arrest precedes cardiac arrest. If they have to leave a person unattended, they should put them in the recovery position. Otherwise, they should initiate the Save Me steps. They should stimulate the person, and if unresponsive, call 911. Airway should then be secured and ventilation with 1 breath every 5 seconds performed. The person should then be evaluated to see if they are breathing spontaneously. If not, 1 ml of naloxone can be drawn up and injected intramuscularly. This can be done through the clothing into the shoulder, buttocks, or anterior thighs. The person should then be evaluated with regards to the need for a second dose. Naloxone, or Narcan, is a safe and effective medication that prevents or reverses the effects of opioids by competitively occupying the opioid receptor sites in the brain. There is no or very limited potential for misuse. It does not cause intoxication. It only works on opioids, and it can be administered safely in the context of a polydrug overdose. Each take-home naloxone kit contains 3 ampules of 0.4 milligrams or 1 ml of naloxone, 3 safety syringes with retractable needles, 3 alcohol swabs, 1 pair of gloves, a one-way rescue breathing barrier mask, instructions on how to respond to an opioid overdose, and contact information on where to obtain a replacement kit. If the person starts breathing on their own or is going to be left alone for any time, they should be put in the recovery position. This will keep their airway open and prevent them from vomiting or choking. Someone should stay at the scene until EMS arrives. It is important for people to know that under the Good Samaritan Act, no charges will be laid if there are drugs, paraphernalia, or evidence of a crime at the scene. The provision of take-home naloxone training is an ideal opportunity to engage patients who use drugs, to assess for the risk of harm and overdose, to educate them on safer drug use and harm reduction strategies, to distribute take-home naloxone kits and resources for community support and overdose prevention, and finally, to empower patients to engage not only in harm reduction, but also to seek resources for testing for HIV and hepatitis C, as well as addiction treatment. In the event that the take-home naloxone kit was used to reverse an overdose, or their kit was lost or stolen, a replacement kit can be provided. take-home naloxone kit replacements are also available for expired naloxone. When giving a replacement kit, key concepts should be covered to ensure the patient is familiar and comfortable with how to use it. This would include recognizing the signs of an overdose, knowing how to respond with regards to rescue breathing or injection, and calling 911. We should provide the patient with information on community resources as well, again to take the opportunity to engage them in services. Naloxone is an unscheduled medication that does not require a prescription. And now for the paperwork. The department tracking form must be updated each time a kit is dispensed. If a take-home naloxone kit is dispensed to a patient who previously had one, it must be indicated as a replacement kit on the tracking form. If the patient's previous kit was used to reverse an overdose, a kit replacement form must be filled out. At the end of each month, the completed kit tracking and kit replacement forms must be emailed or faxed to the Take-Home Naloxone program in your community. Please encourage patients to call the Take-Home Naloxone program in their community to get additional training for themselves, their family and friends, or to access harm reduction and addiction services support and resources. Physicians must document all interventions related to patient care as part of the professional expectations of their college. If you should have any questions, please contact the Take-Home Naloxone program in your community. And for a list of these programs, visit the Government of Saskatchewan website.